Welcome to the Data for Nutrition regular webinar series. We're thankful if it's morning, afternoon, or evening that you're joining us. Today we're going to be having a webinar about visualizing nutrition data for decision making and looking at what we can learn from tools developed for global audiences and country users in India. I know many of us have become more or less Zoom proficient, but before we start, we do want to make sure that everyone knows how we're using the platform today. So we will mute all participant videos and microphones during the presentation. So the speakers will be speaking over their slides, but you will not actually see them on video for the sake of bandwidth. We encourage you to use, there's two actually boxes where you can type in. We encourage you to use the chat box with the bubble. If you would like to chat with another participant, you can send them a direct message or to contact Riley Auer, who is our overall coordinator, if you're having any sort of logistical problems with the platform. Please use the chat box. But we'd like you to use the Q&A button to submit your questions for the panelists. So please go ahead and type in your questions while the presentations are going. And also after, and we will get to as many of the questions as we can. We will be recording this webinar, so a recording along with the questions and answers will be posted in the community of practice, as well as a written summary of the Q&A and copies of the slide deck. So we encourage, if you'd like to share this with anyone, please do let them know that it will be available. We know that nothing is perfect, so if you're still having trouble, again, please use that Zoom chat box and select, instead of all panelists, you can actually select all panelists, or you can select Riley to let her know, and we will do our best to respond to you during the webinar, although we can't fully guarantee that we will, just as we're dealing with logistics. So just want to remind folks that the Data for Nutrition community of practice exists to provide members with opportunities to share knowledge, experience, and questions relevant to strengthening the nutrition data value chain at all levels, so global level, country level, district level, household level, for the purpose of achieving better nutrition outcomes in low and middle income countries. We're really excited to say that as of today, we have 475 members. So we thank especially those of you who joined just to join this webinar, but we're continuing to grow. And we do want to encourage, this is really open to the whole community. So if you have something you would like to share, if you have something you'd like to highlight, or a topic you'd like discussed, we really welcome that. And we really welcome this to be a platform for anyone who wants to share through a webinar or a moderated discussion or through a posting. Today, I'm your moderator. My name is Rebecca Heitkamp, and I'm a faculty member at the Johns Hopkins Bloomberg School of Public Health. We have two speakers today who will be presenting on the topic of data visualization tools for decisions. Dr. Yashodhara Rana leads the data practice work at the nutrition team at Results for Development and is part of the DataDENT Results for Development work. Her work spans a range of topics in nutrition that includes a review of nutrition evidence for the African Development Bank's multi-sector food nutrition strategy, adaptive evaluation of the Launch Food Accelerator program, and more recently, she was a learning advisor at USAID's Advancing Nutrition Project. She holds a PhD in public policy from the Pardee Rand Graduate School and a BA from Dartmouth College. And our second speaker will be Manita Jangid, who is a program manager at IFPRI, the International Food Policy Research Institute. Her research focuses on nutrition coverage measurement in South Asia, and she coordinates the DataDENT IFPRI work. Manita has 15 years of program experience in nutrition, adolescent, gender, and health policy in India and the United States. She holds an MPA and with a public health focus from Rutgers and a master's in science in food and nutrition from Delhi University. So we're very excited to have them as our speakers. The work that they are talking about, both at the global level and in India, was completed as part of an initiative called Data for Decisions to Expand Nutrition Transformation, DataDENT, which is a 4-year initiative funded by the Bill and Melinda Gates Foundation to transform the availability and use of nutrition data. And so we encourage you, if you're interested to learn more about this work or other work, to check out www.datadent.org. And for that, we will go ahead. So Yasho, I will stop sharing and allow you to go ahead and share your slides. Welcome.
Thanks, Rebecca. So good morning, good afternoon, good evening, everyone. It is a pleasure to present our work on data visualization tools for nutrition. Today, I will touch upon two key areas. First, what is a data visualization tool and why should we care? And then second, how do data visualization tools contribute to the nutrition landscape? And here I will be presenting the results of a landscaping exercise that our team conducted in 2018-2019. So to start with, what is a data visualization tool? Data visualization is the process of graphically displaying data to tell a story. So it can include visual representation of data, which could be single graphics or a set of graphics assembled as a unit. So then you may ask, why do we need to really visualize data? Data are more persuasive as graphs compared to tables. The human brain more rapidly processes visuals compared to text. And this is especially important for decision makers who have limited time to engage with data. And so data visualization tools can be effective in helping facilitate decision making, can be used for advocacy and communication. Let me unpack this by using one of the most common examples, which I'm sure all of us can relate to in our day-to-day lives. So the car dashboard. So there's a lot that goes into running a car, as we know, but the data that you see in the car dashboard is very selective, very much focused on the decisions that you as the driver need to make. So what you can see in this picture is centrally located is the speed dial, the most visible indicator reflecting the need that you need to constantly pay attention to it, or else you're going to get a ticket. Another one is the empty tank sign, which turns on, which tells you that you need to fill your tank. And nowadays we have the seatbelt sign along with a noise, which tells you that you need to fasten your seatbelt. So you can imagine that there must have been a lot of user-centered research that has gone into designing this dashboard, especially to select indicators that are important, but also are actionable by you as the driver. But dashboards are, of course, not only the only DVT tools that are out there. In addition to dashboards, what you can see in the screen, there are scorecards, indices, and profiles. And all of these 4 DVTs can be largely classified into 3 main categories, corresponding to different goals, audiences, and the decisions that they are trying to affect. So first, tools that are aimed at promoting accountability. That is, am I making progress towards my goals? Second, tools aimed at supporting management decisions and actions. That is, am I doing what I need to do to achieve my goals? And then third, tools aimed at informing. And we know that different people want to know different things and have different information needs. So what we see in actual real life is that tools tend to mix different goals and audiences. So you could have a DVT that's aiming to hold stakeholders accountable while also still informing a broader audience. But what is important is to be clear about the goals and the audience when deciding to develop a tool. So now that we have this background, moving to the next part of my presentation, how do data visualization tools contribute to the nutrition landscape? Let me first start by explaining our methodology. We followed a 3-step process, if I were to simplify. The first is we first defined global data visualization tools for nutrition as all tools that display some nutrition data. Second, we then carried out a desk review and consultations to identify all existing tools. And through this process, we actually found 32 tools. And then third, we finally excluded all the tools that were not publicly accessible or weren't active in the past 5 years. So that dropped down the 32 tools to 22 tools. We realized that since we conducted this work last year, there have been other relevant tools that are now available. And one that comes to my mind at this time is the African Leaders Nutrition Scorecard, just as an example. While these have not been included in our analysis, we believe that the 4 key insights that I am going to share that stem from our landscape analysis is relevant for even these newer tools, as well as the many DVTs that are being shared in response to the need to access data for the COVID pandemic. So now turning to the findings. First, there's a growing number of DVTs in nutrition, and through our review, we found 22 of them. So this slide puts together, shows you all the 22 tools that we have included in our review. And I'll pause here so you have a chance to look through these tools. These tools vary quite widely. Some of them have a singular focus. So on the left-hand side, you'll see tools on breastfeeding, anemia, iodine fortification, or vitamin A. And on the right side, you'll see others have a broad focus. So sun meal, GNR country profiles, countdown dashboards. Some DVDs are more geared towards promoting accountability, so the Global Hunger Index. Others are more focused on supporting planning and implementation. So as an example, the Global Fortification Data Exchange. And then you have many in the between that have a dual accountability and action goals. So examples include HANSI, ATNI, Sunmeal. Some tools have multiple outputs. So they also, in addition to having a scorecard or a dashboard, they might also include other forms of DVTs within them. Many contain a variety of visualization formats, the most common being graphs, but there are tools that also include maps. And we found 5 tools that were interactive. That is, basically they allow the users to display different variables or alter the input to change the output shown by the tool. As an example, the WHO Target Tracker, it has a what if tab in which you as the user can change the start date and the annual rate of reduction or increase towards their goal in order for countries to set their own targets. Some are refreshed annually and others less frequently. And lastly, the number of indicators reported vary significantly between these different tools, going from 1 to 150, with 33 being the average that we found in our review. Our second finding is that the growing number of tools covering similar domains and using different methodologies may lead to mixed messages. This slide provides an example in which you can show on the top that there are 3 different DVTs that are tracking more broadly political commitment domain for 4 different countries. And here we've actually taken the data from these DVTs itself. So on the left-hand side, you see the traffic light ranking of the inclusion of WHA targets in nutrition plans by Sunmeal. In the middle, you see the ranking of nutrition targets and their quality by the Action Against Hunger Scorecard on measuring progress towards ending malnutrition. And then on the very right, you see the political commitment ranking of countries by the Hunger and Nutrition Commitment Index. As you can see, traffic light ranking varies significantly across these tools. This is just an example, and the indicators as well as the methodologies are different. So it's not necessarily right to compare these tools ranking across, but they do operate in the same domain. That is the tracking political commitment domain. And so that might send different messages to different audiences. A third finding is that few of the tools that we reviewed have a focused theory of change. Many DVDs reviewed seem to have implicitly broad theories of change, meaning that they did not necessarily specify, most of them actually specify their target audience, but what was missing in addition was a clear articulation of decisions or behaviors that they're trying to influence in their target audience and the pathway of how their data actions leads to change. And one example of a DVD that actually does a really good job on this, which we've not included in our review, given it's on malaria, but is a good example to keep in mind, is the African Leaders Malaria Alliance ALMA Scorecard, which is often lauded as a successful DVT because 1, it has a focused theory of change with a very targeted set of decision makers. So in this case, the African heads of states it is supporting. Second, it has actionable indicators that align with the agenda of these African heads of state. These actionable indicators that you can see at the bottom of this slide are color-coded, as well as include upward, downward arrows to show progress over time, as well as these heads of states are provided with recommended actions to facilitate what action can be taken. And third, a strong engagement strategy with their targeted decision makers. So heads of states are provided with quarterly reports on progress. They also meet regularly as part of ALMA. When requested, ALMA also facilitates connections to provide technical assistance to countries. Another example of a DVT that we did include in our review was the HANSI, which aims to assess governments on their political commitment to tracking hunger and undernutrition. So as you can see on the top part of this slide, the theory of change is very much focused on measuring political commitment, and it is doing so by enabling civil society to put pressure on governments, but also encouraging governments to evaluate their own efforts and to prioritize appropriate action. So for this reason, on the bottom half of the screen, you'll see that HANSI's domains are narrowly focused on public spending, policies, and laws that reflect country commitment. Our last finding is that actionable indicators represent a minority of indicators, making these tools less effective for management decisions. So maybe to go back to our car dashboard example, it's not only useful to know whether your car is working or not, but rather you need the information that you as the driver can act upon. So in the case of nutrition, DVDs could still include more actionable indicators to support decision-making, namely around three domains. The first being the enabling environment, the second on enacted legislations, and third on coverage. So maybe just to elaborate one of these, in the case of coverage indicators, one of the most obvious gaps are coverage indicators for interventions, which makes it very difficult for decision makers to know what coverage gaps there are, where, and so where do they really need to prioritize their attention. As I say this, I think it's also important to acknowledge, and something we learned from our DVT reviews also, is that a lot of the indicators are included in these DVTs based on data availability. And so this is also a data prioritization issue. So it's not that DVTs are not just including it, but for many of these indicators, data is also not available. So moving to the last section, so what are some of the recommendations then? So we have recommendations for two sets of audience, and I'll start first with the DVT producers. First, to have a clear theory of change, namely to have clarity on which decisions by which users does the DVT aim to support. In addition, what supporting actions are needed to deliver the change. Second, to include actionable indicators that align with the DVT's theory of change. In addition to actually including indicators with little to no data, to draw more attention to the importance of collecting data for these indicators. And then third, to ensure visualizations format align with user needs and data literacy. So can users actually interpret and understand the data you're visualizing? Next, for the global community of DVT producers and funders, we encourage, first, strong coordination to increase synergies, reduce inefficiencies, and to share learning. Along the same lines, the next recommendation is to especially convene and coordinate across DVTs that report on common indicators, common domains, to avoid divergent messages. And finally, to also strengthen capacity of targeted users to interpret and use data for decision making. Thank you, and I will now hand it back to Rebecca.
Great, thank you so much, Yasho. So as Manita is going on to share her screen, and again, she'll be taking us now specifically to India, I do want to remind everyone that you can use the Q&A button while they're speaking or after the sessions to submit our questions to our panelists. We will read these questions aloud. We will not actually have people verbally give questions during the panel. So we do encourage you to use that Q&A button to submit your questions. All right, thanks. Welcome, Manita.
Thanks, Rebecca. Building on the global work, we decided to learn country context in one of the DataDENT's focus countries. And given the scope and growing focus on nutrition data, we did a landscaping review of data visualization tools for nutrition in India. And the study was led by IFPRI along with Niti Aayog, policy think tank at Government of India, and Results for Development as co-investigators. So our key questions were, first, to know what all DVTs in India have nutrition data. Second, what is the goal of each DVT and the theory of change? Thirdly, how nutrition DVTs in India access these DVTs to meet their data needs, and also to understand strengths and challenges of these Indian DVTs, and what can be learned and recommend to improve the landscape of nutrition DVTs in India. This slide talks about a study methodology that includes 3 steps. So first, under the desk review, we did include DVTs that include nutrition data and which were publicly accessible, produced, or refreshed within the past 5 years. And we found 10 such DVTs through internet search and partner referrals. And secondly, we conducted 7 in-depth interviews with producers who were responsible for conceptualizing, deciding DVT content and design, and their overall management. The aim was to know the DVT's theory of change, who are the users, output, dissemination processes, and so on. And thirdly, an online user survey was administered with 35 nutrition stakeholders to understand user perspective on nutrition data needs, preferences, and challenges in accessing and using data. In today's presentation, and in the interest of time, my focus will be to share key findings emerging from a desk review and producers interview. User components will be further analyzed and integrated in the overall scope of work. Just to deep dive into the desk review process, for the desk review, we looked into goals of each DVT, which were grouped broadly into 1, accountability, and secondly, planning, implementation, and monitoring. Accountability, we mean like DVTs that tend to focus more on outcome indicators and use color codings or ranking, and planning and implementation monitoring provides range of data around input and coverage indicators that supports policymakers and implementers. Secondly, under desk review, we also did an extensive indicator mapping across domains to see in what all nutrition indicators each DVT maps across inputs, coverage, determinants, and outcomes. And these were mapped against the India Nutrition Indicator Framework. It's a body of work led by IFPRI along with Niti Aayog and ID Insight, where we have proposed a list of interventions, determinants, and outcomes aligning with the Poshan Abhiyan, that is India's National Nutrition Mission framework. This work is yet to be published very soon. We also looked into design elements of each of these 10 DVTs in terms of what are the figures, bar graphs, trend, how did they decided on the design elements. And lastly, the desk review was also looked into different kinds of data sources used by DVTs to populate data, including administrative sources and population-based surveys. So coming straight to the key findings of our study, firstly, similar to the global work as Yashu has shared, there is a growing number of nutrition DVTs in India, which are tailored to national policies that can facilitate in-country decision-making. We found 10 publicly accessible nutrition DVTs in India, 9 of which were launched in a 24-month time frame. And the timeline here reflects the launch period of each DVTs. And around the launch of Poshan Abhiyan, if you notice, in 2018, 3 DVTs supported by government departments were launched. For example, Jan Andolan Dashboard, Anemia Mukt Bharat Dashboard, Niti Aayog Champions of Change. So it clearly reflects the demand and the need of nutrition data in a visualized world in India. So of the 10 DVTs, 5 DVTs were produced by the government, 3 using government-owned administrative data. Firstly, Anemia Mukt Bharat Dashboard by Ministry of Health, supported by UNICEF, is aimed to monitor progress on anemia targets to support program implementation. Champions of Change by Niti Aayog aims to track progress of 116 aspirational districts and publish rankings on a monthly basis. Jan Andolan dashboard by Ministry of Women and Child Development uses administrative data to monitor Poshan Abhiyan activities, especially Jan Andolan. Niti Aayog State Nutrition Dashboard, yet another, provides state and district-wide comparison on key nutrition coverage and outcome indicators using NFHS 4 data. And Nutrition India Dashboard aims to provide reference nutrition data to policymakers and program implementers. Just to add here in the slide, rarely DVTs fall into one of the types of DVTs mentioned in the global presentation by Yashu, that is different, for example, dashboard or scorecard index. They often mix goals and features across the different types. For example, Anemia Mukh Bharat is dashboard plus have profiles and scorecards as well. And 5 of them were produced by development partners, often using data from population-based surveys, most commonly being NFHS 2015, NFHS 4, 2015-16, equivalent to DHS surveys in India. Nutrition Atlas dashboard provides data at different levels to facilitate decision-making. Poshan District Nutrition Profiles by IFPRI is a dashboard to present a snapshot of district-level nutrition status in a visual manner for district policymakers. Tata NIN dashboard aims to provide governments to determine food fortification needs in different regions of India and also provide nutrition information. Brookings India Health Monitor dashboard, it is more of a health focus, but it does include nutrition data. Nutrition on My Radar Screen is quite a recent launch in the space of DVTs in 2020, and that provides comparative state district nutrition data in the form of a radar diagram. Our second finding shows that most nutrition DVTs in India reviewed have clear purpose and audience, but few specified how their DVT will contribute to users taking action, such as theory of change. And looking at goal and purpose of DVTs, we found that majority of DVTs were designed to support planning, implementation, and monitoring. 5 out of 10 DVTs goals were planning and implementation monitoring, whereas Niti Aayog State Dashboard was meant for accountability. 4 DVT goals have both planning and implementation and accountability. And we inferred these goals based on our criteria and the self-description on their website and output typology, then confirmed via producer interviews. And based on our producer interview findings, indicators in DVTs were selected based on data availability and their goal. And these are some of the examples in the half of the slide in below. For example, to monitor progress, to generate comparison, some said to align with UNICEF framework, to include, or to highlight a problem. Those were the basis to select indicators in different DVTs. And these are some of the anecdotal shared by producers, why they selected different indicators in their DVTs. In terms of audience, these DVTs target multiple audiences, most commonly government stakeholders at different levels, national, state, and district. And we also found, for example, Tata NIN dashboard is meant for FSSAI or Niti Aayog, policymakers, agriculture part, and researchers. And the target audience geography here reflects that where these DVTs target their audience at subnational level or national level. And it was found that in India, out of 10, 8 DVTs data is covering subnational data, including state and district level data in India. So on a positive note, Indian DVTs have outlined general purpose and goal and target audiences, but have not clearly outlined the pathways, how those behaviors in the target audience they are trying to change, and how the data made available would facilitate that. So that still needs to be think of. Similar to global findings, many indicators are repeated with different data sources and definitions, which may lead to mixed messages. Next. DVTs often report on the same indicators, but use different data sources, including both administrative and population-based surveys. So this was one of the common findings. For example, their indicator on early initiation of breastfeeding using different data sources. Some are using HMIS and some are using NFHS 4 or at some places there were no data source mentioned. So these were some of the variabilities. And these data sources also vary in sample methodologies, whether data was collected at household or facility level, time and frequency of data collection. Therefore, that can yield to different statistics. In terms of indicator definition differences, they tend to fall into 4 categories across DVTs. One is the time frame, that is the recall period for an indicator, age group, that is age of the population of interest, delivery platforms, that's location, such as community or AWC Anganwadi Center or service antenatal care for interventions. And fourthly, around provider type in terms of definition of professionals for an intervention, such as if there is for an indicator mentioned details for whether it's a doctor, A&M or nurse, midwife, those kind of variations. A third finding is that input and intervention coverage indicators on adolescents, lactation and newborn care are missing in most DVTs. We conducted an extensive indicator mapping of all 10 DVTs to map indicators across life stages, input, coverage, determinants, and outcomes. And we found that input and intervention coverage indicators on adolescents, lactation, and newborn care were scarce across DVTs. But out of the 10, 9 DVTs have outcome indicators. To achieve nutrition outcomes, data on input and coverage were important to monitor progress. And this table shows, where are the orange bars shows that there were no indicator under those DVTs across these intervention coverage or input, immediate determinants, underlying or nutrition outcomes. So we have mapped considering the India monitoring framework, but this is just to show that majority of Indian DVTs were having indicators variability and the goals may differ. But it's just to highlight the gaps that there are critical indicators which are still not being covered. A fourth finding is some visualizations within DVT lack information needed for user interpretation, such as DVT descriptions, visualization labels, or indicator definitions. A few examples, some DVTs used complicated diagrams and graphs. So on the left, you can see a complex nutrition on my radar screen. It uses complex diagram of radar, but they believe during the interview, we found that we believed them to be helpful for policy stakeholders because they consolidated data onto one page and showing linkages and priorities and gaps. However, there was no user research conducted with this DVT to verify ease of radar diagram interpretation. A second example on the right is for Jan Andolan dashboard, which shows a donut graph without clear labels, leaving the reader quite unsure of what data was being presented. As depicted above, it showed different government ministry labels, but did not have a graph title or indicators. So such examples users may face difficulty to interpret. Coming to recommendations, some of the recommendations to improve the DVT landscape in India are to build DVTs around a theory of change, including identifying which decisions by which stakeholders they aim to support and what actions are needed to deliver change. Secondly, collaborate with other Indian DVT producers to increase synergies across DVTs, bring uniformity to indicator definitions, and avoid duplication. Thirdly, include additional input and coverage indicators that align with the DVT's theory of change and support in planning and implementation of programs. Fourth, continue to support users to better use and interpret the data from DVTs, and further strengthen the design and use of the DVTs by conducting user research to understand data literacy and user needs. Thank you.
Great, thank you so much. So as we are transitioning to our Q&A time, we have about 15 minutes where we can have some questions and answers. I do want to remind everyone to please use that Q&A button, and you're welcome to submit them. I will be monitoring what comes into the Q&A and trying to direct it to our panelists, our two presenters. But of course, we also, as we said, we'll have a follow-up where we share these answers as well. So first, I just want to say quite a number of people have been just sharing comments about how they enjoyed and how they were great presentations, which I will echo. I think those were both excellent presentations. And so starting off, we actually have a question that I think it came in after the global DVT presentation, but I think it actually applies to both. So this recommendation around strengthening the capacity of users to actually use the DVT. Are there any examples that you know of where the producer has done something to build the capacity of its users? And what does that look like? So in terms of building the user's capacity to actually make use of the tool. So either, I think Yasho and Manita, you're both open. So whichever one of you wants to go ahead.
I'm happy to go first, Rebecca. So I think thank you for the question. I've been thinking about this, and I think the example that comes to my mind is, again, the ALMA scorecard, because the purpose there wasn't just to put out the data for the users to interpret and use, but they have built mechanisms in order to engage the users. So quarterly reports where they're not only presenting the data, but they're also presenting key messages that these heads of states can take from the scorecards. That we also know that there's a lot of follow-ups that the ALMA has with the heads of states and their offices behind the scenes, even after the data is presented, and they do provide guidance to states in terms of how to make progress, on these indicators that have been included. So it's just not a presentation of here is the data for you to use, but there is a lot of engagement that is built around, helping the heads of states to use their data to move towards action. So just wanted to share that as an example. But as I was thinking about this question, I think there are also some things, some smaller pieces of things that DVTs could do more of. And one was, the example that Manita was giving around, when you're providing a statistic, providing users with the ability to understand whether the statistic is good or bad is very helpful. Having very clear definitions is also very helpful. So there might be minor things that DVD producers can already do within their existing visualizations so that users are able to interpret data more broadly. So that is one. And the other one that we both found in our reviews is that there isn't a lot of user research that is done around developing the DVTs. So whether it's around selecting the indicators or even thinking about which visualization formats to include. And I think we often come to this with a perspective of the formats that we're comfortable with. So whether it's a stacked bar or a pie chart, but that might not be the kind of visualization that our audience, let's say, for most DVDs, it's government stakeholders might be more comfortable with. So I think doing a bit more around user research, both during the development of the DVT, but as doing some evaluation as these DVTs are rolled out could also be done.
Yeah, thanks, Rebecca and Yasho. Just to add, based on the India experience, even to engage with users, we have some good examples from Poshan DNPs, where from the beginning, they did engage with district officials to understand their nutrition data needs. And also they developed, along with their DNP, they developed a guide that provides information on the, about their about the profile, how they have chosen the indicators, what does that mean, and how that can be used just as a reference. And similarly, we have seen in other DVDs such as Tata NIN dashboard and even Champions of Change, where they have a reference guide on their internet about how the users can understand in terms of the content documentation webpage explaining what content is available on each tab of their DVT, how they have aggregated data, indicator definitions, and sources. So those are some of the really helpful tools for users and guides. And based on their resources, some DVTs have also undertaken some trainings. For example, Champions of Change held a training with users when they launched their dashboard.
Great.
Thanks.
Thanks so much to you both. Another question, so I'm going through the questions and trying to group maybe some themes and let you respond to that kind of as a theme. So I apologize, I don't think we're gonna get to everything, but a couple of people have raised the question of users, asking about whether or not we have a sense of to what extent the DVTs are being used in terms of the number of the users, who they are. There was also a very specific question about getting more audiences to use these, so very connected, and particularly mentioning how can we get local NGOs to be better able to access the tools. So could you each maybe comment a little bit about maybe what you do know or what you're hoping to learn? I know, Manita, you said there's still another phase about the users.
Yeah, Rebecca, that's a great question. Just on the user part, to what extent users are using. So based on the producer interviews we had in India, they did mention that they are not doing in a very structured manner to assess like who is using their DVT or some kind of analysis, but they have more anecdotal experience. But they're keen to kind of institute some mechanisms to kind of get user feedback and improvise on the existing DVTs. That's one area. And in terms of in terms of dissemination, they had these different channels where they are spreading the word within the departments or through social medias or spreading the word in meetings and things like those. But there isn't like a structured way where they have thought through to kind of engage users and get that data to who are using it and for what purposes. That still needs to be learned more.
Great. We have a question about whether either on the global or in the India example, whether any of these DVTs are looking at facility or district level quality of nutrition services. So specifically about content, whether you're aware in these, if any were focused on not just coverage, I think, but the quality of services.
So I'm going to skip this, Rebecca, because we did the global DVT reviews, and this doesn't get to the level of detail that would be required at the district level. But maybe just to share another piece of work we're doing under DataDENT is we are developing we are working closely with the Nigeria Governors Forum to develop a nutrition scorecard, which is not targeted at the district level. It is targeted at the enabling environment indicators that the governors would be interested to influence. But as we're thinking of these indicators and these commitments, we're not only paying attention to, is the commitment completed or not, but also the quality of the commitment. So in the case of, let's say, if we're asking for creches to be established in public institutions, we're also trying to capture like the functionality dimension of these creches and if they have breastfeeding, complementary feeding provisions. So not exactly an example at the district level, but just wanted to share that, quality is also something that we've also been thinking about, another piece of work that we're doing.
Manita, did any, I think you did highlight that, did any of the DVTs you look at have something about district level?
Yeah, so in India, most of the DVTs, around 8 out of 10, 8 DVTs have data on district level and state level. And most of it is pulled from population-based surveys, NFHS 4, and some government DVTs also have their administrative data, HMIS, coming from there, feeding into their DVTs. So those are, yeah, and in terms of the quality of services, there isn't like, they have coverage indicators, but I'm not sure like to what extent they are covering those. We have not reviewed, to see quality is being covered, but definitely coverage indicators are there in DVTs.
Great, and I think India is unique because you do have these national surveys with district level estimates, right? So that's definitely part of it, I'm sure.
Yes.
This is, I think, a great comment by one of our things talking about, and I think this is true for both the global, even though you didn't present a timeline, there's 20-something nutrition DVTs, right? And then the comment was the number of DVTs launched, in the person's opinion, was very high for such a short period. So I think especially looking at India. And would love to have both of your thoughts about whether this is a good thing or a bad thing. And then we'll have a follow-up question, which a couple of people have brought about coordination, but maybe just your gut sense, or maybe what your teams kind of thought about as you thought about this proliferation of DBTs. Do you think of that as being good or bad, or do you have a perspective on that?
So I'm happy to give a gut response on that. So even in the case of the global DBTs, we didn't have a slide on, the timeline, but between 2017 and 2018, the majority of the DBTs that we reviewed came around. So with these proliferation, I think on one hand, if these are on different topic areas, maybe this isn't such a bad issue. This isn't so much of a problem if some are focused on anemia, or let's say others are focused on vitamin A. But we did find that there was a lot of overlapping indicators across DBT. So we looked at 5 specific tools and at least had 33 overlapping indicators. And this goes to the point that, we are seeing multiple indicators across DBTs, sometimes with differing definitions, sometimes using different data sources. So in the absence of some level of coordination, having all of these DBTs sprung around at the same time, can make it confusing for the users. And we're just shown one example for how political domain was defined across different DBTs, and the different ways these things were visualized. So I think there is an issue around so many DBTs coming around if they are overlapping domains and indicators, and if there isn't coordination.
Yeah, thanks, Yasho. So just to add what you have said, I echo what you're saying in terms of to ensure quality and avoid repetition of indicators information. I feel there should be some kind of coordination among these DBT producers to kind of think through and come up and consolidate, come up with a high quality DBT, having updated data. So we did find, like, even in India, some DBT, for instance, nutrition on my radar screen, they are using radar diagrams only. But if you can integrate those radar diagrams in the existing one, which are being more used by users or which are popular, that would add more value and usability of that. So something of those kind, if we can kind of come together as producers and see what are the gaps and address them. And some of these DVDs in India are like, they're static. They have been developed like for once, and there hasn't been any updates to those. For instance, state nutrition dashboard. So they have used Tableau and put together data using NFHS4, but they are not often updated and looked into through. So it would be good to kind of convene and think of ways to synergize and harmonize the indicators and other data sources.
So we did have one question, a couple, and I think it was the second part of that question is whether there's any examples where you saw there was some effort on the producer's part to coordinate. My gut is no, but or nothing stood out. If they did it, you weren't able to kind of get that as part of the review. But I just want to leave space. Were there any examples for either of you of where you saw coordination happening on the producer side to kind of address some of these issues you've just been talking about?
None from our end, Rebecca, but I'm also hoping that now that we have these findings, it actually functions to get attention and to lead towards coordination, because I don't think I've seen mapping of indicators across DVDs to really hit home this message around that there is overlap and there is differences that are stemming around that can be confusing. So perhaps this is a follow-on next step from this.
Yeah, Rebecca here. I won't be able to say, yeah, I don't think so, because each DVT has their own goals and they are kind of, updating those with their goals in mind. But as a next step of the study, we plan to, convene with producers and share our findings and find ways to take this forward.
Great, thanks. One thought that I had, this is just my own comment, and I'm taking the privilege of being the moderator, is that, if we talk about a proliferation of tools, it's not a problem maybe if they're very specific. You're talking about the lack of theory of change. Well, if a certain tool needs to be designed because it's going to reach a very specific audience and develop a certain action, that seems really that could justify why you create a tool. But if it's a bunch of general tools that are proliferating because people are excited about having a tool online, but maybe have not thought through this theory of change, that was just a thought that I had. And I don't know if that resonates with either of you, that the proliferation, it might depend on how specific it is.
Yeah, that's true, Rebecca. I totally agree what you've said, that for some DVTs, for instance, they are very specific and their goals are, and the targeted audience is quite specific. So they do have a value of the investment of the resources. But there are some DVTs, even in India space, where they have been created once, like let's say 2 years or 3 years back then, and there hasn't been any updates or any revision. They have just, or there could be multiple reasons for those, maybe lack of resources or even the capacities and etc. But yes, I do agree what you've said in terms of the goals.
Also the same here, Rebecca, something that I also forgot to mention. And I also think maybe in some ways proliferation is a good thing, because in some ways it is signaling that nutrition is getting more attention. We are trying to assess, monitor, hold stakeholders accountable. So proliferation in itself could not be a bad thing, but as long as there is clarity around, theories of change and who is supposed to use the tool and for what purpose, I think that would be critical.
Thank you. I want to note, we're getting lots of wonderful questions. We're getting a lot of very specific to India context comments, which I think are valuable. So I do want to tell everyone who stayed on through the Q&A, we will be compiling and also giving our panelists a chance to, where they can, give some responses to those, and we'll have those publicly posted. So please don't feel like if we haven't specifically gotten to your question that we'll leave it unanswered. I'd also like to note that there's been some nice dialogue happening in the Q&A where I've seen some examples. So there was a question about the means of accessing digital literacy specifically for DVTs, and we have Tricia from Johns Hopkins responded to that and gave some examples. So we appreciate it and do welcome those of you who can offer some responses. And again, we'll collate that. So maybe just because I think we have time for one more general question that will allow for both of you to respond to. So we've talked a lot about recommendations for producers, and someone wants to know, have you, and I would maybe add, or do you have a plan for how have you engaged the producers with these findings yet? And if not, what is your plan to do so?
Yasha, would you like to respond? Or
Thank you. Manita, do you want to go first?
Yes, sure. So we haven't shared so far these findings. They are very initial findings, and we are consolidating the overall landscaping work, including even the user and survey findings in this work. But we do plan to engage with the producers and share and see where what are the gaps and what are the next steps in terms of harmonizing these indicators and data sources across DVTs, and also to see how can they engage with users to understand their needs and make those changes in the existing DVTs. So that's our initial plan, to kind of have a consultation with those DVTs and DVT producers and share our findings and come up with some kind of like a standard or a mock DVT, that ideal DVT for India, where we should have all nutrition data, relevant nutrition data at one place, which is updated. That's just a thought. So we do plan to engage with them.
Yasha?
Yeah. So on our end, also, we are in the process of conducting global user research. So with that piece of work, we're trying to unpack who are these users of global DVTs, how are they using them, for what purposes, what are some strengths and challenges. So we're hoping to first wrap that piece of work so that when we go back to the producers, we're not only going with a review of the tools that they've put out, but also with feedback from users. So that's probably one piece of work that we're waiting to complete before we do that. But meantime, we are engaging several of these DVT producers informally, where we have presented our findings in a couple of conferences. We have connected with DVD producers, for example, with Sunmeal stakeholders. And so I think this is something on the top of our minds, which we would like to do maybe a couple of months down the lane. Maybe the time would also be right, because I'm imagining with COVID, there will be a flurry of new data sources and DVDs. And so this might be, this piece of work might not only be relevant for helping facilitate coordination within our space of nutrition global DVTs, but there might be lessons learned for producers more broadly. So definitely something that we're hoping to do once we complete our global user research. We'll probably, on the global side, we'll have to think a bit more around, how to bring the set of producers together, given they have different domains, different targeted users. So something maybe to look out for down a few months down the lane.
Great. Thank you both so much. Like I said, so many wonderful questions and comments have come in, and we really will make an effort to do some follow-up on those, and within a week have a posted summary and follow-up on the Data for Nutrition Community of Practice. While I have your attention, before I formally close, I do want to, so we were intentional about keeping this DVT webinar, which we've been planning for a long time, because we think some of us are hungry to not always be thinking about COVID, although we also know that COVID presents some interesting measurement issues. And so next week on Wednesday, we're going to be having a really exciting webinar that was inspired by the Agriculture to Nutrition Community of Practice discussion several weeks ago about the implications of COVID for agriculture and nutrition pathways. There were some questions about, well, M&E and some so we're going to have a webinar next week that's highlighting 4 different groups that have gone ahead and modified or rolled out mobile phone-based approaches to measure food insecurity very specifically. And we'll be advertising that quite a bit over the coming week. So we encourage you to watch this space and come back. We also hope to be doing another webinar in the near future about this whole area of data visualization, with potentially some examples coming out of other countries and other groups that are working in this issue of data visualization tools. So again, keep watching the Community of Practice for those announcements. But just for today, I really want to say thank you to everyone for participating. Special thanks to our speakers, Yasho and Manita. Really want to thank you. We thank you for everyone who submitted questions or just who participated. Like we said, a summary will be available, and you'll be able to share that. And so others who have missed it will be able to watch this webinar. And we really encourage your feedback on this webinar in particular, but also, like we said, this is a community platform. And so if you have work that you are interested in highlighting or questions that you would like to have the community come together on, please do contact Riley Auer, who is our Community of Practice coordinator, and we'll see about the ways that we can get you to use the platform to further your work. Again, so thank you everyone. Please stay safe, and we look forward to seeing you again soon.